Welcome, everyone. Welcome to the Hope Talk series. For those of you who are not familiar with neuroabilities, we provide evaluation and treatment for children and adults with neurological, developmental, and behavioral concerns. And I would just invite you to learn more about us at neuroabilities.com. My name is Sandra Lewis. I'm the Director of Marketing and Community Affairs. And today I would like to introduce our speaker, Erin O'Brien. Erin is a board-certified behavior analyst providing ABA therapy and supervision at our clinic in Cherry Hill. Erin received her bachelor's degree in psychology from St. Joseph's University and her master's in learning disabilities from Rowan University. Prior to becoming a BCBA, Erin worked in area hospitals and home settings, providing early intervention services to children ages 0 to 3 and offering family support. Today, Erin will be addressing, is co-sleeping becoming a pain in your neck? The presentation will run approximately 30 minutes, and we ask if you have questions along the way, please enter them into the chat, and she will address all questions at the end of the presentation. Erin?
Yep.
It's all yours.
Okay, great. Well, welcome, everyone. So today we're going to discuss issues surrounding co-sleeping and bed sharing and some strategies you can use to transition your child to falling asleep and staying asleep in their own bed. A lot of times this may have happened as a short-term problem or it's been a long-term problem. The longer it's happening, it may take a little bit longer to break, but hopefully we can review some strategies today that'll help you get that transition to be smooth. So first, we're just going to talk about what exactly co-sleeping is. And co-sleeping is the practice in which babies and young children sleep in close proximity to one or both parents, as opposed to in a separate room. So globally, co-sleeping just means that you're going to share the same space, physical space, not necessarily the same bed, but you're in sensory proximity to one another and you can sense the presence of another person. On the other hand, bed sharing is a type of co-sleeping where you're sharing the same sleeping surface or same bed as your child. I did also want to note that it is common practice in some cultures to practice co-sleeping and bed sharing. And research does indicate that when co-sleeping is a choice, there are fewer reported sleep problems. However, in cultures and societies where solitary sleep is favored, increased sleep problems and disturbances are associated with co-sleeping. So likely you're here today because you're looking for some strategies, and co-sleeping and bed sharing has been disruptive to your sleep. So we're going to review some pros and cons regarding co-sleeping and bed sharing. So when we look at the pros of co-sleeping and bed sharing, when dealing with infants, it can be much easier for nighttime feedings if we're sharing that same physical space with our child, especially for breastfeeding parents. It's just more convenient and much more conducive to keeping that sleep going. You can quickly feed your child and move on. There are some parents that also see it as a time to bond with their children, and they also report that they feel closer to their child in this practice. Sometimes this is how co-sleeping starts and then eventually becomes more of a problem. So now we're going to talk about some of the cons associated with co-sleeping and bed sharing. So first is disturbed sleep. I put this picture here. I'm sure if anyone shared a bed with a child, you can relate to this. Kids move frequently throughout the night. They can kick you, they can sleep in all kinds of positions. So when this happens and you're sharing that close sleep space, it can lead to disturbed sleep for both the parent and the child. Another concern and con of this is sudden infant death syndrome, or SIDS. The American Academy of Pediatrics actually warns against bed sharing due to the increased risk of SIDS. And another concern is the increased risk of accidents or injury. Things like suffocation or even death can occur when participating in bed sharing due to the child either being trapped between or underneath parents during sleep. So how do you get your child to sleep in their own bed? So we're going to review some strategies, and some of those are going to be implementing a consistent bedtime routine. You're going to hear me use the word consistent a lot throughout this presentation. That's one of the keys to helping this transition. Another strategy we'll discuss is the fading method. And then finally, we'll talk about using a transitional object. So our first strategy is implementing a bedtime routine. This is something you're going to want to implement consistently and daily, even on the weekends. A lot of time our schedule's a little more flexible on the weekends, a little more loose, but you still want to make sure you're implementing this routine on a daily basis. You can start by just winding down the household about 30 to 60 minutes before bedtime. This would include doing things like dimming the lights, making sure screens are off, and just making the household a little quieter in general. The actual routine should just be limited to 3 to 5 activities. You don't want to do any more than that. And the activities you can include are things like having a small snack, brushing their teeth, taking a bath, putting on pajamas, reading a story, or singing a song. You don't want to do all of these. You want to pick the ones that would fit with your specific situation and scenario, might be more beneficial to your child and helpful to put into that routine in the evening. And you want to make sure you complete the steps in the same order each night. You want this routine to be predictable, something that's very common, and the child knows exactly what's going to happen, and it just helps with that wind down practice. You also want to make the bedroom environment conducive to sleep and consistent, and this would involve keeping the bedroom cool, dark, and quiet. Another thing that you can also try is making the routine visual, and I'll show some examples on the next few slides of what that would look like. But first, we can look at just a bedtime routine example that I came up with. So we have here that we would start with eating a small snack, then you would transition to brushing the child's teeth, putting on their pajamas, reading a story, and then saying goodnight and lights out. So you can see here we included 4 activities, and we're going to do those activities in the same order each evening. And here are some visual examples. So this one here, I found most of these just doing a Google image search. So you can find one on Google Images, or you could create one yourself that fits your own specific routine that you've implemented. This one here, you can check off each activity as you go along. Here's another example of a visual. And like I said, I just found these on Google, but again, you could just find pictures on your own and put them into a Word document, print it out. You can bring it around with you in the evening as you transition each activity. You can have it hanging in your child's room, whatever works best for you. Okay, so those are some examples. So now we have our bedtime routine implemented and it's consistent and we know what we're doing. We're going to talk about how we can include the fading method as part of the transition for your child to go back to their bed. This involves just taking steps to gradually fade yourself out of your child's room until they're sleeping in their own room and in their own bed independently. So before you start, you really want to get them excited about it. Talk up the idea about them sleeping in their big kid bed. You can maybe add something new to the room, like buy a new nightlight. Sometimes you might want to consider getting some bedding that's their favorite character, just like really building it up and making it exciting and a great idea that they're going to be sleeping in their own bed and in their own room. Go off your child's interest. What you really want to focus on is putting a positive spin on this. And you can start this process a few days before you actually implement the steps that we're going to review in a couple slides of implementing the fading method, but just building that base of getting them excited and looking forward to sleeping in their own bed. As with the bedtime routine, you're going to need to stay consistent. So part of this method is going to probably involve you getting out of bed in the middle of the night to take your child back to their bed. So you could end up missing a little bit more sleep than you're used to. So if you know there's a big project coming up at work or something that's going to prevent you from following through on the steps, wait to implement this until you know you can follow through and stay consistent. Going through the process, depending on how long your child's been sleeping with you, could take a little bit of time. It could take a few weeks. So you really want to make sure you can commit and set that time aside and really focus on following through on each of the steps. We can modify this based on your specific child's needs. So there may be steps you can skip. You might have to add a few more steps in. But overall, this will be a good framework to work from that you can modify based on your own needs. So we're going to go over some steps. There are 3 steps that I included for the fading method. And I'm using a scenario of a situation where the child is falling asleep in the parent's bed and staying there throughout the night. So they're not sleeping in their own bed at all. So based on your own situation, you may be able to take a step out, but we're just going to kind of go with the worst case scenario here and work from there. So this situation is a child who was falling asleep in their parent's bed and staying there throughout the night. So the first thing we want to do, we've gotten them excited. We have our bedtime routine established. We're going through our bedtime routine. Our first step is that the child will fall asleep in their own bed with the parent present in their room. So what you're going to do is complete your bedtime routine. You're going to tell your child good night and you're going to turn off the lights. After saying good night, you want to make sure you minimize eye contact and avoid any verbal interactions with your child. You also want to avoid adding anything extra. You don't want to be rubbing their back or their head, which, may be something that you're inclined to do, but it's just another thing you're going to have to fade out at some point. So avoid adding anything extra during this step. But you can just stay in the room until they fall asleep. And again, you're not really interacting with them. You're just a presence in the room so they can sense that you're there to help soothe themselves to sleep. After you've done this for 3 nights successfully, where the child falls asleep in their own bed with you present in the room, you can move on to step 2. Now, during this step, if at any point your child in the middle of the night finds their way into your bed, you can still allow that to happen. We're just kind of doing small steps here, getting them used to just falling asleep in their own bed with you present. Okay, so that's step 1. So now we've been successful at step 1 for 3 nights. We're going to move on to step 2. So step 2 is that the child will now fall asleep in their own bed without the parent present in the room. So you're going to follow the same step as before in completing your bedtime routine. And then you're going to tell the child good night, turn off the lights, and at this point, you're going to leave the room. If at any point the child comes out of the room before falling asleep, you're just going to guide them back to bed. You're going to repeat this as many times as you need to. If they come out a million times, you're going to start going, you have to take them back that many times. You're just going to really stay consistent and make sure they know that it's bedtime, it's time to stay in their bed, and you're just going to keep taking them back. During this step and the following step, this is when your child's probably going to start pulling on your heartstrings a little bit. You're going to start feeling a little bad. They might start asking for extra hugs. They might say, oh, wait, I need one more drink of water. So if you can anticipate those are the things that your child may ask for, make sure you take care of all of those needs before you say goodnight and turn off the lights. Give a big hug, give that extra hug then, make sure they have that last drink of water. So that way you'll feel more confident and comfortable just taking them right back to their bed. You want to make sure you're also minimizing any interactions at this point. Don't get sucked into long discussions. Just keep repeating, it's bedtime, it's time to go to sleep, and take them back to their bed. Also, your child should fall asleep, I would think at most between 15 and 20 minutes. So it shouldn't take too long for them to nod off. So after you've been successful in this step for 3 nights in a row, and you're able to have them fall asleep in their own bed without you present in the room, we're going to move on to step 3. And as with step 1, you can still allow your child to come into your room in the middle of the night at this point, because we're going to address that in the next step. So our final step is step 3, and that will be that the child falls asleep and stays asleep in their own bed throughout the night. So this is likely going to be the most challenging step for parents. This is when you're going to have to get out of bed and take them back after you've been asleep yourself. I know this is going to be really difficult. We all have commitments the next day. We have work. You're vulnerable in the middle of the night because you're tired. So this is when you're really going to have that resolve and follow through with the steps and stay consistent and take them back to their bed. So you're going to start by completing your bedtime routine again. Again, you're going to tell your child good night, turn off the lights, and leave the room. At this point, we know they can fall asleep in their own bed without you present, so that shouldn't be an issue. But they may wake up in the middle of the night and come to you. And at that point, you're going to guide them back to their bed. Again, you're going to minimize those verbal interactions, minimize that eye contact, and just get them back in their bed and close the door. And you're going to have to repeat this each time they attempt to get into your bed in the middle of the night. If your child's successful, you can reinforce them for this by letting them know how proud you are. Really make a big deal about it. You slept in your bed by yourself all night. That's really great. You might consider maybe taking a special trip to the park, maybe getting them a special treat or a special ice cream or something like that. But really let them know that this was a great thing that they were able to do. You may end up having a couple of nights of success and then maybe a little bit of backtracking. So make sure you're prepared for that and get right back into that routine of taking them back into their beds. This could go on for a while. So that's why you want to really make sure you're prepared to commit and follow through on all of the steps. Okay, so another strategy that you can consider when using the fading method is the use of what we can call a transitional object. And this would be an item of comfort. It can be something like a favorite stuffed animal or a cozy blanket, something that they can use that would help soothe themselves back to sleep when they wake up alone in their room in the middle of the night. And you can talk to them about this object, let them know what it's used for, tell them, like, if you wake up in the middle of the night, give your bear a hug, it'll help you fall back to sleep. Just so it's something that they can use, because it's an important skill for them to learn, that they don't always need you to help them get back to sleep, that they can do it on their own. And this object could be something that would help with that. Okay, so some considerations to keep in mind. You can adapt this protocol to your needs, as I mentioned before. Not everyone probably is in that specific scenario that I reviewed with the steps for the fading method. But if your child, maybe if they're falling asleep in their own bed, but they're coming to you in the middle of the night, maybe you start at step 3 and you just start there and follow through with the steps at that point. If your child's having a little bit more difficulty and it's really hard to have that separation, you could consider staying in your child's room with them, maybe having a mattress on the floor, and then you just progressively move the mattress further and further away until you're out of the room. You can also provide your child choices within the bedtime routine. So we talked about making sure that routine's predictable and completed in the same steps each night. But maybe when it's story time, you allow them to choose the book that you're going to read. When it's time to pick out pajamas, they can choose what pajamas to wear. If you're using a snack, give them a choice of 2 snacks to pick. So it gives them a little bit of control within the routine, but it still keeps that routine predictable and consistent. Other things you may consider is using a sound machine or blackout curtains in your child's room. Just any of those things that lead to sleep and are like environmental factors that would promote sleep and good sleeping conditions. But if there's one thing I want you to take away from this today is that consistency is key. You want to be prepared for scenarios that will pop up that you may not have been anticipating. So for example, stomach bugs always manage to strike in the middle of the night, right? Like that's when your child's going to get sick. So be prepared for that. Be prepared to sleep in your child's room if that situation arises. Another thing that might pop up is nightmares. Children tend to have nightmares and want comfort from their parent, which is completely understandable. But in that situation, you're going to go to your child's room. You really want to avoid having them sleep in your room under any circumstances during this transition and for a good amount of time after, because once you allow that in, it could become right back as a habit. Also, in order to really see success, you're going to want to follow through with the steps consistently. You're not going to see the results you want without consistent implementation. But if you put forth the effort up front, it really will pay off in the long run when you're getting that peaceful, restful, and undisturbed full night's sleep. And I also did want to mention that there are some medical conditions that can impact a child's sleep. So if you're seeing anything like that, you definitely want to talk to your child's doctor just to rule out any medical concerns. But if it just seems to be a habit that's developed and you're just really trying to break it, hopefully these steps that we reviewed can help you get through that and help with that transition. So now we have time for questions if there are any. Let me open up the chat.
We have one question, Erin. What age should I start these steps?
So I would say you can start them at any point. Like these steps can be done at any time. I know, like I mentioned, especially when children are younger and they're feeding in the middle of the night, once that part is done and the expectation would be for them to sleep in their own room, you can start at any time. As long as it'll work for you and you're kind of past that nighttime feeding stage. Any other questions?
Please feel free to take yourself off of mute if you have any questions for Erin.
I can unshare this too.
Erin, I have a question. What about if you have multiple children?
Yeah, that can be like an issue. A lot of times children share rooms. I know just from my personal experience, I can't speak to everyone's children. I know my sister, when I was younger, had night terrors, and apparently I slept through the whole thing. So you should be able to still implement these steps. And as long as you're minimizing the language that you're engaging in with your child and really keeping that interaction limited, you shouldn't really disturb the other children. So hopefully that wouldn't be an issue. Let me see, we have some other questions here. What if you already have an older child that comes in the middle of the night? You can still use these same steps. I would just tell them it's time to go back to their bed. I don't know, like if there's a specific issue, if it's nightmares or something like that. But really it's just like the consistency aspect. It's just like setting that expectation and making sure that you follow through so that they know you mean what you say, and that's the expectation, is that they sleep in their own bed. So these strategies can apply to any age. We have a question about breastfeeding mothers. Yeah, I would suggest waiting until they're not feeding in the middle of the night anymore, just so that way it's easier on the parent. Like it completely makes sense that you would have your child with you if they're still feeding in the middle of the night, because that's just makes it's easier for everybody. But at the point when your child's able to sleep through the night, you can immediately start setting that expectation that they should be in their own bed and in their own room. And then the last question is, would this be harder if my child has autism? Children with autism do tend to have rigidities and prefer routine, so it could take a little bit longer to make these steps effective. But again, that, like I said, that consistency is really key. If you stick with it, you should see results. It may take a little bit longer. Let me see, I just have one more here. I have the question here about they finally got their child back into his own bed, but they're staying with him until he falls asleep. And then within 30 minutes, he's asking them to come back. I would just try and set that expectation. If he's already asleep, just take him back and let him know, like, you can be reassuring and let him know everything's okay. Maybe I know 12-year-old's a little old for like a transitional object, but it could be like a blanket or something, just that they can have them to soothe themselves back to sleep, just to give them some strategies to help get back to sleep. And you can reassure him that, like everything's fine, but I would just follow the same steps with that. Just like keep taking him back and let him know everything's okay. I think I got through all of them. Are there any other ones? Yeah, I also want to acknowledge, I know this isn't easy. I know it's easy for me to, give these strategies and go ahead and do them. But when you're tired in the middle of the night, it's really challenging and really hard to do. But if you really kind of have the mental resolve to stick with it and stay consistent, you will see results. So someone said, what will happen with nightmare during this transition? I would, if it's really, like your child's really upset, I would at all costs avoid bringing them to you and maybe stay with them in their room. If you want to soothe them back to sleep while they're in their room, if they've had a nightmare, that will definitely work better with these steps than bringing them to you. That may require you to lose a little bit more sleep, but in the long run, you really want to set that expectation that they sleep in their own bed and in their own room.